Hi, Dr. Desmond White, gastroenterologist. If you have H. pylori infection, you saw your doctor, what should you do to treat it? Actually, we have several guidelines on how to treat H. pylori. We have experts recommending first and second line treatment. The first line is usually two antibiotics with an axis suppressant. And the different brand, they're all similar in the efficacy in treating H. pylori. The two antibiotic first line are usually amoxicillin and clarithromycin. It can be amoxicillin with other antibiotic besides clarithromycin, such as levofloxacin. So one acid medicine, two antibiotic. We give it for about 10 to 14 days, and we can achieve a success rate of roughly 90%, about 85%. After that, some patients just feel better and they don't come back. But we normally recommend them coming back to do a Urea Breath Test to confirm that the H. pylori have been successfully killed. That's important because if they have the infection, they treat antibiotic. If they don't confirm that the bacteria is dead, and later on when they have problem, then we can't tell how bad it is. One example that I just saw recently is that a patient had H. pylori gastritis. He took the standard treatment for 2 weeks. He felt better after that. His doctor asked him to do a urea breath test to confirm that the bacteria is dead. He didn't, he was busy, and he felt better. And about 6 months later, he felt the same discomfort again. He saw the same GP, they did the urea breath test, it was positive. He came and see me for a second opinion. So then, in this case, you have the bacteria, we are treated, we don't confirm successful eradication, and the bacteria again, that will result in two possibilities. Either he had persistent infection, his H. pylori did not respond to the first line of treatment. If that's the case, we shall give him second line of treatment. Or it can be he responded to the first line of treatment, he was okay, but because of his job, he needed to travel regularly to the region. He may have eaten some food that were not completely clean. He reinfected with the H. pylori. If we think they're reinfected, then we can give him the first line antibiotic. Other way, difficult to manage. So remember, if you have H. pylori infection and you see a doctor for eradication, it's one gastric medicine and two antibiotics. After that, it is highly recommended, not by me, but by expert, to confirm that you have successfully killed it. If we don't kill it, it may create trouble in future where we don't know whether it's a persistent infection with a resistant H. pylori or it is a reinfection with the same strain. I hope I don't confuse you too much, Dr. Desmond White.